So the first question we have is kind of a general question. And what we've decided to do this time was to kind of group the questions surrounding some thematic areas. And the thematic areas are risk and exposure questions, mental health questions, grandfamilies and caregiver questions, and then testing questions. So I'm sure there'll be follow-up questions as we go. So please, again, don't hesitate to type those into the chat function if you can, or save them for the live question and answer. The first question is, what are the tools that we as community members and individuals have in our toolbox to keep ourselves safe? How do we apply those things to our everyday lives?
So I'll take that first question. Thank you, Nicole. So we know, we have quite a bit of knowledge about respiratory pathogens in general, so pathogens that infect the lungs, and how those spread, including the SARS-CoV-2. And so we can use that knowledge to help us build some basic tools that we can use to try to keep ourselves safe and keep others safe. And so that knowledge includes things that I'm sure have heard about, droplet size, how far those droplets can spread if you expel them through coughing, sneezing, talking, singing, etc. How long the virus can live on different surfaces, whether they're hard, non-porous, or if they're soft or porous materials. So we can use all of that knowledge to our advantage to keep us safe. And these are very basic things that I'm sure all of us have heard about at one time or another. I will start with the first and most obvious thing, and that is wear a mask. If you're going out, if you're an essential worker and you have to go to work, I'm sure most employers are now requiring those masks, and they can greatly reduce the aerosol spread of the virus. We've also heard about hand washing. That's also extremely important. Try avoiding touching your face. A mask will actually help you avoid touching your face as well, sort of a preemptive barrier to that. Social distancing, right? That 6-foot space combined with a mask is hugely effective at minimizing transmission. If you can be outside instead of meeting indoors, that is a huge help as well, because if you're outside and you're wearing a mask, even small particles that might escape your mask are quickly dissipated with the airflow around you, and it's diluted into the air. And so avoiding indoor congregations and congregating in very tight spaces is a great idea. So, again, try to avoid things like huge events, indoor events, dining in restaurants. If you can dine outside instead of inside. Personally, I am not comfortable dining out yet at all. But just using those sort of common sense things based on the knowledge we know about how the virus is transmitted is hugely important. And in lieu of a vaccine, are our best strategies for minimizing spread. And so with that, I think I'll let Dr. Ellis fill in some things that he'd like to tell you.
Yeah, thanks, Mark. And I want to focus somewhat on the masking or lack thereof. And I think if you've been out at all, you've noticed that people have variable concepts of what a mask is and how to wear it. So I've seen quite a bit of information over the last month on the effectiveness of just cloth face masks. And I was very skeptical of the protectiveness that a cloth face mask, even a 2 or 3 ply cloth face mask, could provide. However, the evidence that I've seen recently shows that, in fact, wearing a cloth face mask correctly gives a lot of protection, both for the wearer and for those people around. And if the people if everyone is wearing a cloth face mask and wearing it correctly, then you get quite a bit of protection. You get added protection because you're protecting people from your breath and what might be in your breath. You're stopping the droplets for sure, like Mark just said. And then if the other person or other people around you are also wearing those masks, it helps protect you from them. So there's dual protection if everybody is wearing it correctly. However, make sure if you're wearing your mask that you do wear it correctly and that it fits correctly. It should be up over your nose. It should be fairly snug. It doesn't have to be absolutely tight, but fairly snug around your face so that aerosols or droplets have to filter through the mask. They don't go just around the mask. It's really frustrating to me after years and decades of training people how to work safely in laboratories with personal protective equipment, and part of that being N95 masks, not just a face mask. But I would caution against thinking that you actually need an N95 for everything, because to properly wear an N95, even if you could get an N95, they're almost non-available. You should be fit tested for that N95 with a quantitative or at least a qualitative fit test to make sure it's fitting correctly. So stick with the cloth mask when you're out. I see a lot of people, they think if it's hanging on their ears, for some reason that's going to protect whatever comes out of their mouth and nose, whether it's over their mouth and nose or not. And that is a terrible misconception. And people should wear it up so that it does cover their nose. People's faces differ. And if they would just find masks that do stay up, you can tie them, you can do whatever. A couple of the ones that I have are a little bit fitted so they stay up over my nose, and they're comfortable. They're very comfortable to wear. So there's a lot of benefit to wearing those types of face masks. And I think Dr. Zabel covered pretty much everything else. But if other questions come up, we can hit this a little bit more later on too.
Thank you, Bob and Mark. The next questions are really related to, as we talked about the tools like hand washing, mask wearing, distance, etc., about how you could apply those tools in specific circumstances. So the first question of that type is, what specific autoimmune diseases make someone a higher risk? Or is it just that any autoimmune disease makes someone a higher risk? And this is assuming that some of the fatal complications are a result of an overreaction of the immune system.
Yeah, thanks, Nicole. I'll start that too. I'm trained as an immunologist as well. And so what I would say is that any condition that starts your immune system makes you at a higher risk for developing severe COVID-19. And so that includes autoimmune diseases where your immune system is already primed and working, but unfortunately working against your own body, against your own cells. But that hyper-activated state of your immune system also allows it to attack cells in your lungs, for example, that are infected with COVID, trying to remove those cells and eliminate them because they're infected. That's what the immune system is supposed to do. But we do know that the immune system produces many compounds, we call them cytokines, that can be very toxic to our own host cells in an effort to eliminate cells that have been infected. So autoimmunity that affects the lungs would be probably something that's more preferentially affecting the severity of COVID-19 or the susceptibility to SARS-CoV-2 infection, but also things like asthma, any respiratory illnesses. We've heard that diabetes is also a comorbidity. Anything that really increases the activity of your immune system will make you more susceptible to severe COVID-19 and for infection, but particularly any immune responses that that occur in your lungs will even make that even more severe.
And I really don't have anything to add to that. I think Mark has covered that very well. So what you want is a really healthy immune system, not autoimmune disease, not hyperimmunity, not hypo, nor low levels of immunity, but you want a nice normal immune system that can respond to these types of foreign antigens, foreign particles that get into your body, infectious particles. And there's going to be a little bit of a touch and go response to start with, because you need to have time to build up your specific immunity that can then have antibodies specific to this particular virus. We haven't seen this virus before. So it's not that we've been able to have any cross immunity to it. It appears that it's novel enough that we really don't have cross immunity from any previous experiences. So those first few days to a week are critical. And if your immune system is healthy and can respond to this particular virus, then that starts to turn the tide against the virus and in favor of your health.
Yeah, thanks, Bob. And you did bring up something that I did want to touch on. That is hyporeactivity. So when your immune system isn't working quite as well, that also can cause problems, because you can't avoid the infection and you can't fight the infection off once infected. And so that is why older individuals and people who are immunocompromised, so instead of having a hyperactive immune system, but they have a depressed immune system, are also at greater risk.
Thank you, guys. That was really, really informative. This next question kind of maybe speaks to a little bit of that as well, in terms of risk and how to mitigate risk depending on your own specific health issues. But in general, how long do you need to be in an airspace with someone that has COVID to potentially become exposed or infected?
Thanks, Nicole. Well, oh, Bob, go ahead.
No, go ahead.
Okay, yeah. I promise everyone that I will be quiet after a few of these first questions. But this goes back to that first question about what's in your toolkit. So the knowledge of how this virus spreads is really important for avoiding those situations that really facilitate that spread. So for example, sitting in a movie theater next to somebody shoulder to shoulder, or on an airplane for extended hours shoulder to shoulder in an indoor environment is a great way to spread the virus, right? Because it's contact time, it's how long you're next to the person and how close you are to that person that is going to determine how efficiently you can transfer droplets, and if you're infected, the virus itself. And so that's why most health experts recommend wearing a mask in those closed environments in an indoor environment. But for example, if you're out running or biking or jogging on a trail and you are passing individuals as you do those activities, the contact time is less than a second. Often the distance is much greater than 3 to 6 feet. And so the risk of transmitting the virus in those situations is much, much lower than if you are, shoulder to shoulder sitting there for hours next to someone. And so that's why the recommendations for running or cycling haven't been necessarily to wear a mask, especially since, those activities increase your respiration, so how much you're breathing. And a mask, when you are at an elevated exertion level, can restrict your breathing and be detrimental to your health too. So it's really duration and distance that's going to determine the transmission efficiency, and also frequency of those contacts too. How often are you next to those individuals, for how long and how close?
Yeah, and I'd like to add to that too, it's a numbers game. So Mark has told you about instances of where there could be close exposure, where you're distancing yourself and just maybe passing by someone quickly on a bike. But it's also a numbers game. It depends on how much, and if we're talking specifically about the SARS coronavirus 2 or the disease COVID-19, it's specifically how much virus those people are shedding. And we don't know right now exactly how many viruses it takes, what the infectious dose is for another human. And that infectious dose is going to vary from human to human too. If we think of healthy adult humans, not everybody's going to be susceptible to the exact same amount, but we're not talking about 1 or 2 virus particles. We would be talking about hundreds of thousands or possibly millions. So it depends on how much virus these people are shedding and how close you are, as has already been described, but then also how much of that virus gets into your respiratory system, onto your mucosal membranes, your nasal area primarily, and how much of that then gets down to other places in your body, possibly in your respiratory tract, where there are cells that those viruses can infect. So it's truly a numbers game. Not everybody that you come in contact with, even if they might be shedding the virus, not everybody is going to infect you personally. But protect yourself as much as you possibly can, and then you're going to be safe from the people that might be shedding the virus and might have the potential of infecting you.
Thank you. And just so the audience knows, I see your questions in the chat. They're excellent questions. We're going to do our best to get to all of them. I'm going to move to another another question that we got prior to the webinar about food safety, and this one applies to Meals on Wheels. There's a question about Meals on Wheels of Loveland and Berthoud transition from delivering a hot meal every weekday to delivering a week of frozen meals once a week on Tuesdays. We are being asked, when can we go back to daily deliveries? From your point of view, what's keeping us from returning to daily deliveries?
Nicole, were you passing that to me? Hello? Can you hear me?
Yes, sorry, I was muted. Yes, to you, Marissa. Thank you.
Okay, I'm sorry, I didn't catch that. Well, there were probably several factors that influenced that situation, but the main one being risk of exposure to both the delivery staff or the recipients during the delivery process. But some of the other factors could include that daily deliveries, are going to add up to many more steps, like washing hands and sanitizing surfaces, once a week versus 7 times a week. And then that would also require the need for more protective gear, like gloves and masks. And so that may be part of the decision process. But another factor, may be that demand for meals has gone up, so that by grouping deliveries, it can be more efficient in order to serve more people. And then the other factor that I could think of is that delivering, a week's worth of meals ensures that meals are available in case there are illnesses and daily meals can't be delivered. So I think that was, a smart decision. I do hope that they can change that soon. But meal variety is really important right now to all of us. And I'm going to turn it over to Sue for some information about some alternative resources that recipients could consider.
Yeah, we're finding a lot in our surveys and assessments that food insecurity is one of the really pressing problems with this pandemic. And so this doesn't necessarily directly address the Meals on Wheels question, but I see a lot of you who are not just in Larimer County, but throughout the state, just making sure you know where some of these resources are. You can always go to Hunger Free Colorado. They have a food resource hotline. I'll put that phone number in the chat box. United Way 211 offers statewide resources. The area agencies on aging, for those of you who are working with older adults, throughout the state provide nutrition supports and information. So you can look up your local area agency on aging, and I'll put information in the chat box just so you all know what some of those resources are on a statewide level.
Thanks, Sue and Marissa. I'm going to skip around just a little bit so we can get to a variety of these questions, and then also make sure that we're available for live questions at the end. We're going to skip now to the mental health, the questions surrounding mental health. And the first question was, what strategies can be taken to provide socialization to an isolated aging population?
Christine and I will be tackling this one. Christine, are you okay if I just sort of start and we'll tag team this?
Yes, of course.
So I guess one of the pieces I want to really sort of stress is that, you know, social isolation in older adults has been a problem for decades. So it is definitely exacerbated now. But I will also say that with it being a bigger problem, there are a lot more resources than there were in the past. And so at the aging clinic, we really stress to people that you want to try and kind of not have black and white thinking about, well, I'm just going to wait until I can see my parent or grandparent until this is over, that you really want to be thinking about what you can do kind of at every stage of the pandemic. And even if it's little steps, you know, it doesn't have to be the perfect meeting, but having family members or friends try and reach out more via phone calls. Try to come up with a schedule. We really have been stressing this a lot with some of our clients, that one of the things that works for all of us, any age, is when we're feeling anxious or stressed about what's going on in the world, is structure. And so I think for some people, time just sort of seems like it flows with no boundaries nowadays. And so we really encourage people to put some structure in there. And that means structure in terms of, if you are caring for somebody or you have somebody in your family that you're worried about social isolation, then come up with a calendar for family and friends and say, who's going to write a letter this day? Who's going to make a phone call this day? Depending on how interested they are in technology-based resources, there are so many opportunities to do things like virtual traveling, virtual tours. At the aging clinic, we offer for free all sorts of services. If you want to learn how to take a tour with a family member, we will help set that up. If you just want to connect with other older adults in the community. But I think I really want to stress that instead of sort of getting in the weeds to the point that you just feel out of control, it's really important to sort of say, what can I be doing for myself or for a loved one during this period? And then coming up with little bits and building on those, but not waiting for this to go away to really start socializing again, because we don't know when that will be. And so we want to be doing some pro-social things in the meantime.
I agree with Deanna, and I think one of the things that what Deanna said, and in my mind I've been thinking about for the last few days, is this idea of encouraging physical distance and social connection. So everything that Bob and Mark talked about at the top of the hour, wearing your masks, perhaps meeting outside, hand washing, is so important. Also in the context of connecting with family members, friends, grandchildren, grandparents. And so keeping that in mind, and keeping in mind also your risk tolerance, as you started talking about perhaps your own or the clients you serve, you know, chronic illness or autoimmune functioning. But I think it's so key what Deanna said. We can't just stop, right? We can't just stop being social creatures, right? We're humans, we're social, we want to connect at various levels. And so I think, again, encouraging physical distance among the clients you serve, but again, practicing, practicing the physical distance encouraging social connection. And I think the other thing that is a misnomer is that older adults oftentimes are thought of as not knowing how to use technology or don't want to use technology. And so if there is any type of technology available to the client you serve or to yourself, you yourself identify as an older adult, consider using it. Consider exploring new things that you never knew, what your iPad did or what your cell phone does, or you know, what that FaceTime is, so to speak. So I think those are so important. I also want to recognize that for some older adults, right, they might not have the resources for that. And so there might be some other creative ways we might think about engaging socially, just as you said, a phone call or a letter. But then thinking about those use of technology is also creating patience, right? Family members sometimes can become impatient with that older adult that, or that other family member, regardless of age, that doesn't know how to turn the audio function on or doesn't know how to turn the video function on. But once that person gets it, it can be really life-changing. And so really consider these different avenues as you combat isolation and loneliness and encourage safe physical distancing and social connections.
And I just want to add to what Christine said. If you are an older adult who maybe is not as familiar with some of the opportunities in terms of technology, or if you have a loved one who is and it maybe doesn't know how to use some of these devices, there are so many programs now that offer free tutorials and free one-on-one support. And so again, even though it may feel overwhelming in the moment, most of these services that we now have virtually, and I agree with Christine 100%, I'm also not ruling out seeing loved ones in person as long as you're listening to Bob and Mark and kind of taking home what the safety precautions are. I think, you know, we had a problem where we started it with social distancing, and as Christine said, it should really be physical distancing, but still socializing. But there are lots of resources right now. So if people are interested, you can find them on the internet. I'm happy to have people email me, but there are all sorts of individuals who are doing free one-on-one tutoring, starting with the phone, starting with paper instructions to get people set up. And then once you're set up, or the older adult in your life is set up, it's really unlimited opportunities to connect with all sorts of other types of resources. So if you're feeling like I wouldn't even know where to start, feel free to email me or to reach out. There are just a number of programs in our county at the university that can help you get yourself or your loved one connected so that you can have some of these other resources available to you.
Yeah, and I loved, Sheila, you put a comment in the chat box about your 92-year-old mom just ordered an iPad. So she's ready to learn, right? And there's something that she's passionate about, right? It looks like perhaps watch church and connect with FaceTime. So I think those are so important. I also want to recognize, if I can, Deanna and Nicole, that I think, you know, Mark had put something in there, Patricia had put something in about, you know, how do you balance perhaps maybe family conflict without, I didn't see anybody really say that, but if one family member who might be living in your home is out and about and you're not, right, and you're wanting to protect yourself, you know, what can you either require or request? And you know, these are hard conversations, and by no means I'm not a clinical psychologist. I'm not trained in that area, but certainly recognize that family conflict can happen. And I think talking about what you're comfortable with in the context of protecting yourself, but also protecting perhaps others, but really kind of owning yourself in that space is really important, and continuing to have those conversations, even if they are difficult or challenging. I think Patricia had said earlier about a son who's come back to move in and tends to go out a little bit, and there was a question around, should I require him to self-isolate in his room for those couple weeks if he knows he was exposed? And so I don't want to necessarily punt that back to Mark or Bob, but I know that early on when COVID was coming out is that there was that focus of if you have been exposed and or if you have COVID, you will need to self-isolate. And so that can certainly be challenging, recognizing that. And I don't know, Deanna, if you want to add anything about, managing family conflict or just conflict in general, about that piece. But I noticed that came up a couple times in the chat, so wanted to just bring that forward.
Yeah, I mean, I think I think everything probably in families and in individuals gets exacerbated when we're in a situation like this where people feel like they don't have control. And for Patricia, who posted, that's definitely starts to sort of infringe on where you do have control, which is your home, and now you're losing control of that. So I think it's really important to have discussions with family members and just be very aware that everybody is a little bit stressed and everybody may not be firing on their full respectful cylinders, just because we all respond to stress a little bit differently. So be patient with each other. But definitely, I think, I know personally in my family, we've had to do a lot more discussing how we're going to help our older adults and our family. And some of that has been pleasant and some of that has been unpleasant. But I think, like Christine said, communication is really key in talking about these issues. And again, if you need outside help, there are all sorts of mental health people who are helping people navigate during this time. And even if you feel like I should be able to handle it, just know that everybody is working with fewer resources when we're in this sort of situation. So it's okay to reach out and get whatever you need for you and your family to get through this.
And I just want to add a resource here for those folks who are working with older adults or for family members who need to learn how to use Zoom as a primary form of connection. CSU's Osher Lifelong Learning Institute is offering free orientation classes. So please think about taking advantage of that. I'm going to post a link right here in the chat.
Thank you all. That was so helpful. I also see a comment in the chat from Karen. Senior Planet and Older Adults Technology Services are a good source of information and social connection for older adults. So if that's helpful. For those of you who may not be able to easily access the chat, we'll try to verbalize those resources as well as maybe send them out as links to those people who have joined us today, along with the video and audio recording of this, so that you have multiple ways you can access that information. The next question is, how can grandparents discuss risks to ourselves and behaviors to keep us safe with our grandchildren in a way that doesn't scare them?
Yeah, Nicole, I'll take that. So gosh, it's such a great question and so important. And so I think, I think this information is really pertinent to those grandparents who have primary responsibility of their grandchildren, but it also could come up amongst ourselves or the clients you serve who have grandchildren that don't live with them full time, right? They might be curious and want to talk to grandma and grandpa about this. And so I think for me, there's three key ways or three key things that I think grandparents should remember. And I will tell you, my other colleagues across the nation who really focus in on parenting have long lists of such suggestions, but recognizing the time and the number of other questions, I think three key things that are really important. And so the first one is, and I kind of feel like the first one is almost two, so maybe there's four, but welcome their questions. And don't avoid questions you can't answer. And so when I think about welcoming their questions, as we know, there's so much up in the air right now. Things seem like they're constantly changing as additional research is being conducted as we learn more. And grandchildren really are bound to have questions that might be as pretty intense as something like, will grandma be okay? Will you be okay? Right? If you being grandma or grandpa who's primary responsibility, to questions like recognizing, or overhearing grandma or grandpa or somebody saying, gosh, that product was not available at the grocery store. So some grandchildren might want to know if their favorite ice cream is going to be available, right? So there's those really those tough ones about our own self and wellness, but then also those things that perhaps grandchildren might really love and enjoy, that they're concerned about, right? And so I think what I would tell you in that case is welcome those questions. And as a grandparent, the goal is to really help the grandchildren to be heard, right? And I would also add to get fact-based information. So as much as you can inform yourself about what are fact-based or research-based information, then you want to share those, that information with the grandchildren that you're interacting with. And I think that information perhaps might be more reassuring, excuse me, than perhaps whatever they might be learning from their friends, right? And so then that second piece of this first one is don't avoid questions you can't answer, right? It's okay to say, I don't know. It's okay to say, you know, the scientists are still trying to figure those things out, right? It might be tempting to say, it'll all be better soon, or, you know, this will all go away soon. We don't know that, right? We know that soon in a grandchild's eyes might be, you know, in the next hour, but soon might be, you know, months from now. So again, welcome those questions. It's okay to say, I don't know. And when you do know more, you might reach back out and say, you know, I actually know more about that question you asked me a month ago. Do you want to learn? Are you ready for me to tell you? And then if they say yes, and they're wanting to move down that path, then you can go ahead and share that. The second thing is, and I think this is absolutely important, is to be developmentally appropriate, right? So the questions that you're going to get asked might be different from a 5-year-old than your 15-year-old grandchild. And then at the end of the day, right, you don't want to necessarily volunteer too much information because that might be too overwhelming based on the developmental progression of the child. And again, they'll focus on honesty and clarity with the fact-based information that you know. And then the third area, and I'll leave you with this, is just, I would also advocate that you share what you're doing to stay safe and what you're doing as a family in the context of the grand family that you're doing to stay safe. So again, going back to perhaps some of the things that Deanna shared, but also Bob and Mark earlier, you know, talk about those things because when we can minimize that emotional response of fear or maybe being scared, that might, you know, help the grandchild move forward in this challenging time. And again, being honest, I think is so important, and being empathetic with the grandchild when a grandchild might show that fear or that emotional response of perhaps being scared.
That was awesome. Thank you, Christine. Really, really helpful. I'm going to skip a little bit now to another question. This one's about actual testing. And there was a question about what is the difference between an antibody test and an antigen test or nasal swab? Which one would give a person more information?
Hi, Nicole. Thanks. I'll start this one. These two different tests actually give you two different pieces of information. So the PCR test that we've heard about, that involves the nasal swabbing that's not so comfortable, actually tests whether or not you are currently infected, whether or not we can detect virus in your nasal passages, which would indicate that you're probably infected all over your body, including your lungs. The other test is an antibody test, and that tests your immune response to the virus. So that can be either during the infection, when your immune response starts to ramp up and start producing antibodies against them, but those antibodies also remain after you have cleared the infection. So it will really tell you whether or not you've ever been exposed to the virus. It will not tell you whether or not you're currently infected with the virus. That's what that PCR test is for.
Thank you. So, so to follow up on that, Mark, what do you think would be the most helpful in terms of getting an antibody test or an antigen test for most individuals? Like, when would you get each?
Sure. Yeah. So the PCR test for the virus is important to know whether or not you are still infected and could spread the virus. The antibody test, so that PCR test is important for determining whether or not, for example, you should distance yourself or quarantine yourself until you clear the virus, or if you can't detect the virus, you may be safer and not be able to spread it as well. I would say, though, that these tests are not 100% accurate and 100% sensitive. So they could miss some cases where you are still infected, but it just you didn't have a positive test. That's why I think most individuals that are testing, most companies, for example, that are testing to get back to work are requiring 2 consecutive positive tests to make sure they didn't miss that test. So that PCR test is really most important for determining things like contact tracing and preventing additional spread. The antibody test is a bit controversial because it does indicate that you've been exposed. So for example, if you use both of those tests in combination and you have a negative PCR test saying that you're not currently infected, but you have a positive antibody test that says you had been infected at some point, people are hoping to use that information to say you're probably less likely to be able to spread the virus if you're PCR negative and antibody positive. We don't absolutely know that to be true. It could be that you mount an antibody response, but still can spread the virus even if it's undetectable. So there's been some caution around using those 2 tests to determine whether or not an individual is safe to return to work or to return to school or to start their normal social activities.
And Mark touched on this a little bit too with the nasal swab antigen test, but also if you have the signs and symptoms of COVID-19, then this can be used to determine whether you have a common cold, whether you have some other type of upper respiratory infection, or whether in fact you do have the COVID-19 infection. So it can be used as a differentiation. And also, like Mark said, I don't know of any test that's absolutely 100% accurate, but that's why you would maybe get sequential tests one after the other, a day apart or something, to make sure that the test was accurate.
Yeah, thank you both. And this is a bit of a follow-up question, I guess, but the concept of being safe to return to work or safe to go back to school, safe being I am not going to give it to others, and that would be the swab test, and safe being I have antibodies, so therefore less likely to get infected, that would be the antibody test. Is that correct?
Yes, I would agree with that.
Thanks. Okay, and then we had a really interesting question. I'm interested on, like, everyone in the panel, what their thoughts are. And I know Bob had volunteered to host this question first, but what do you think about the strategy some people are taking that they might as well just get exposed and get it over with? And we've even heard that from people, in their 60s and over. So this concept, like, rip off the Band-Aid, I'm interested to hear what you all think about that as experts.
Well, I think that's really faulty thinking. I think it's playing with really a dangerous disease, especially for people that are 60 and above. If you read anything about the demographics of the people who are infected, the severity of the infection, the death rates per 100,000 of people who are infected at different age groups, you see that 60 and above, and then especially 60 and above with underlying conditions, then that is really dangerous because it can take you out. It won't just get you over it. It might, you'll be over it, but you won't be around to celebrate. So I really think that's poor thinking. I'm old enough to remember back to when polio was still circulating before the polio vaccines. And polio was certainly a disease that nobody wanted to be exposed to. It killed people, it maimed people for life. It had all kinds of exacerbations after the disease, and you wouldn't want to have been exposed to that at all. After the vaccines came, our US is essentially, or it has been, polio free for decades now. So if we use this example, if we can get a vaccine or even a really effective treatment, then we don't need to live in as much fear as we have right now. As far as this disease is concerned, we can turn that fear more, I think, into respect. But then we need to have these treatments and preventions available before we can really do that. Now, if you back down into the 20s and 30-year-olds and possibly 40s, maybe that could work. I still don't like it. To me, it's just going to keep the disease going longer and longer. I think what we need to do is do the best we can to protect ourselves, all of us, until we do have better treatment for sure, and a vaccine. And hopefully we'll get a vaccine within just a few months and be able to move on with that. And the relief that I saw as a kid, I think I was probably 11, 12 years old when I got the Salk polio vaccine, the injected vaccine, the relief that everybody felt when that happened, it was just amazing. And hopefully we'll see the same type of relief with this particular disease.
Yeah, Bob, I couldn't agree more. And I just wanted to emphasize one point. Herd immunity is a good thing, right? That's what we're trying to get. But how we get there is extremely important. That's why vaccine development is crucial, because that is a way to expose our immune systems to parts of the virus that will produce immunity so that we do not get sick. The other way to get herd immunity is to just rip the Band-Aid off, right, and let it happen. Realize that if you support that way to herd immunity, you are essentially agreeing that, yeah, it's okay if, you know, 500,000 people die before we get there, because that's what we'd be facing. Even 500,000 is a conservative estimate, I would say. If we need to get to 60 to 70% of exposure for herd immunity, you know, that's several hundred million individuals in this country. Depending on what the real fatality rate is, people estimate anywhere from 0.1% to 5%, but that's an easy math calculation. We're talking about hundreds of thousands, if not millions of people dying before we reach herd immunity. For me, that's not acceptable.
I totally agree with that, Mark. And those were really good emphases. Think of 1%, and that's one person in 100. And if we've got 330 million people in the country, like Mark said, that 1%, if we're willing to sacrifice 1 to 5%, that's a lot of people to get to herd immunity before we can do it in a more progressive manner with vaccines and treatments.
Thanks for that perspective. I am curious from like Deanna and Christine and others on the panel, in terms of that sort of feeling like, you know, there's such a polarity between people who feel like they should just sort of rip off the Band-Aid and those who are desperately trying to protect. And how do we kind of live in harmony with that, you know, conflict in our society right now? Do you have any comments on that?
You know, I don't. I think that it kind of gets at what Bob and Mark were talking about. I think there is. I think what you're seeing is a lot of stress on how we frame things, and so I think it's really important to note that for some people, they may be thinking about themselves or their immediate family. And like Mark said, even if you feel very safe in your small group of being able to weather COVID, it kind of comes down to, you know, thinking of us more as a community, that you have to not be thinking just within your little box, that you have to be thinking that Maybe it's a good idea in terms of your family and giving you the most sort of freedom that you could possibly have. But I really think communities where they're stressing that this is about being a good community member or being a good citizen, it just is I don't know how you wrap that around. I think it's whenever I hear people say, well, I don't know, I'm uncomfortable with the mask, or I don't like this, or I don't, it really needs to be sold that it's not about you. It really is about protecting those who can't, who don't have an option in how they weather this. But I don't have the answers on how you successfully convey that to people. So I don't know if I can. Maybe Christine has some ideas.
Yeah, I don't either. You know, I don't have anything to add in that realm other than, you know, being honest with yourself and honest with your friends and family about, you know, how the precautions you're going to take, right? Which might be maybe more in line with the recommendations that we're hearing and that we're seeing are effective in stopping the spread. And that might the person who receives that might feel like you're saying that there's something wrong with them or the way they are thinking or going about. And I think you want to, again, set the tone that it's not about them. It's about how you want to protect yourself and protect others, perhaps in your household. And it's challenging. It's challenging if you've got family members and friends that are on the other end, right? And so I don't have any sage advice, as this is uncharted territory. Again, being honest and calm and really setting the tone for supporting yourself as an individual, but also, as you said, Deanna, as a community, and thinking bigger than just, you know, just ourselves. So
I just want to add, I mean, we talked about this earlier that, you know, we're talking about older adults, but as I mentioned, there's pretty good evidence that everybody is struggling. And a lot of this is a loss of sense of control in your daily life and having things taken away from you. For some people, very serious things taken away in terms of their livelihood. And so I just want to stress that for some people, they've just reached a point psychologically where they sort of feel like, I can't do this forever and I'm at my wit's end. And so I think that, like Christine said, there are a lot of things that as a individual human being, I get really upset and angry when I see behaviors, but I absolutely am also trying to remember that that is how that person is dealing with all of their anxiety and all of their stress. And probably if we were patient and compassionate and sort of could help those people get out of that rut of feeling like I'm going to gain this control back by not following the rules or not wearing a mask, it would be more helpful. So yeah, so patience with each other and knowing that sometimes the root of why those people are doing it is just feeling out of control, and that's one way in their head to get control back. And then just trying to be kind and walk people through sort of in a non-aggressive way what we could be doing better maybe to help regain that sense of control that's not putting people at risk.
That is super good perspective. Thank you, Deanna. I know that we talked about having some time for questions and we're at the end of the hour, but if I could ask the panelists to stay on for maybe not like 5 minutes, as I did promise that we'd have some live Q&A, but you all have had such great comments. So is there someone, I saw, I think Paula may have had a question or tried to unmute and say something. Paula, did you have a question or anything for the panel?
No, thanks.
Oh, okay. Anybody else? Any burning questions? There's been a lot of good stuff in the chat, and I know that the panelists have been trying to answer, but if you have not been able to access the chat, you can ask your question live, or if there's another question, please go ahead and maybe in the next 5 minutes, we'll try to address that. A quiet group. Okay. I think all the ones in the, oh, Sylvia, did you have a question? Nope. Okay. So some good things in the chat here, talking about immune system stuff, talking about blood type. I think then if there's no other burning questions, maybe we'll conclude this session. And once again, I would be very, very grateful for your feedback. Allie can, kind of collate that so that we know how best to serve you in the future. You have been a wonderful audience in providing the questions ahead of time. Maybe we might even increase the time length of this just because there's been such great discussion. I do want to say thank you so much to our panelists for volunteering their time and just their expertise to share with all of you. If you have other topics that you would like our group to address, I'm open to that. We'll find, if these experts aren't, if it's outside their expertise, we'll find the right experts. That's what we're here for. So we really want to make this a helpful webinar for you in the future. We'll probably do this again in about 4 weeks, so keep an eye out for that. And with that, I will let everyone go and say thank you again and have a wonderful day. Stay safe.
Thank you.
Thank you all.